Welcome back. You're still watching Wake Up Nigeria, and now we have a discussion on health. So on health today, we will be talking about drug abuse in children, looking at how parents self-medicate children without diagnosis, right? With Dr. Yusuf Kadri. Good morning to you.
Good morning.
Welcome to Wake Up Nigeria, and I love what you're wearing. I love it so much. I didn't know doctors were so fashionable.
Hello.
I have a doctor for a brother.
Nigeria is such a stressful place. You just have to look for what to do to
make you happy. That's absolutely correct. And your outfit is definitely making me happy this morning.
Thank you.
Okay, I mean, I went through your profile, and I must say it is well robust. Really, how do you manage to balance all that?
All that,
all
right.
that, how?
You know, I tell myself that is, I'm doing God's work.
Yes.
And when you're passionate about something, you don't see it as stress. The moment it becomes stressful,
then you know that there's something wrong,
yeah,
right?
But just to make it sustainable and more impactful,
yes.
Passion, just put a strategy with it.
Okay,
Yeah,
awesome. I mean, something caught my eye. I think a drop of happiness.
Little drops of happy.
Little drops of happy. Can you tell me a little bit about that before we get into the main topic for today?
So Little Drops of Happy is a movie, a feature movie, which we are trying to get to the wider audience.
Okay.
And it's based on Mikabe's depression, postpartum depression, and suicide. So it's a story about a couple and having a kid, and of course, rancor between couples, they always be.
Yes,
but
yes.
She was depressed, and the man didn't think.
He didn't know that.
And then he was, making the depression worse. Wow. Because he was also depressed, not knowing he was.
Wow.
And of course, I'm an African man. I'm a Nigerian.
Exactly.
Men don't get depressed.
I mean, I love it when we talk about mental health, especially in this setting, because a lot of people overlook a lot of things. But I love the fact that now it's coming to
the forefront.
Exactly. So now people have conversations about it. So now we're talking about self-medication, right? How parents literally self-medicate their kids, and of course, we know how that is actually drug abuse. So what do you think about that? Because honestly, growing up, I literally, yeah, I mean, I'll go to school and come back. Before I reach house, my mother will say, you're looking like this, you're looking like, next thing, drip, drip. 3.
Or take this.
I'm telling you, drip straight. But the good thing is that she was a nurse. So, I'm like, okay, it's mommy, so it's fine. So, tell me a little bit about that.
But generally, when you look at medications, right, there are drugs or substances that you use in treating medical conditions or maintaining health.
True.
And it can be prescription drugs or non-prescription. Prescription has to be, given by a medical doctor. Why not prescription? Or over-the-counter drugs are the ones that would everybody can get paracetamol, cough syrup, allergy medication. But the truth is that they are drugs. And when it comes to self-medication, as adults, it may be easy. But for children, it's something that parents should really look into, because the truth is that the moment you start self-medication, that means you are doing the diagnosis and then you are treating and without the doctor's advice. And a lot of times you find out that we leave a lot of medication. Maybe you started one medication, you didn't finish, another one you didn't finish, and then you have like 2, 3 children. Then the middle child has XYZ, and you say, that was how my first child had XYZ.
Yes,
I think it's the same thing. No, it's not the same thing. Because the truth is that why do we even have doctors and pediatricians? It means that, yes, I'm a doctor. Like me, I'm a doctor now, but I'm not a pediatrician. I'm a psychiatrist. So if I have a child that's not feeling fine, I go to a pediatrician. But oftentimes we use the fact that we are parents. We have years of experience.
Exactly.
And we've been there. No. You must calculate the dosage you give a child. So when the child comes, that's why they ask parents, how old is your child? 3 months. The doctor is already calculating the dosage. So if it's a syrup, it's giving you that calculation. But no. They have a concoction. They won't have quantity. They say, just take this and go to the like, for real? True. That kind of, it can make an illness get worse. You can underdiagnose a medical condition. You can overdiagnose. And we still have the highest infant mortality and morbidity in the world. So self-medicating children is a no-no.
Okay, now, so from your experience, what would you say is the major cause of this? I mean, I have a number of things in my head, but let me hear from you. What would you think?
Poverty is there. Ignorance is there. The healthcare system is still very fragile. Even the resources, of course, we saw the exodus and it's still ongoing. The resident doctors are resuming tomorrow after 2 months of being on strike. And so these are some of the things. We are still in that place where, you know, the Abuja Declaration of 2001 says that 50% of our budget should be assigned to health. Only 2 African countries have achieved that, South Africa and Rwanda. We are still struggling with even 5%. And so these are some of the things we're talking about: infrastructure, healthcare financing, and the primary healthcare system where the bulk of the people are in the communities. If I ask you where your primary healthcare sector is now, I'm sure you're like, is that place that dogs and goats used to sleep?
True, there's nothing to write about.
Nothing to write about. But so these are some of the things that are perpetuating, you know, this. Let me just do it myself. All be fine. And of course, the religiosity that we have now, God is in control after all. It's that God that they used to give.
Pray. Okay, now speaking about that, right? Exactly. Now I want to like merge religion and tradition, right? So I was having a conversation with a friend not too long ago, and we were talking about how we're talking about childbirth and all of that, and how, okay, certain women from a certain part of Nigeria, they don't do the normal antenatal and all of that. And then again, they also carry that same behavior after the child is born. They don't go through certain processes because they believe, I mean, our mothers have been doing this even before, do you understand, science like got to this part of the world and everything. So in that situation now, people have literally proven methods to them which traditionally work. What would you say? Would you say, see, ignore all of that and do it? Would you say, okay, fine, medicine is the right way. Do it that way. The same thing with religious beliefs.
No. We do understand that our cultural and religious beliefs are very grounded. And people can't, to even take yourself away from it is difficult. So what do you do as a scientist or bring in the orthodox? If I'm going to introduce anything to the community, I'm not just going to just put them, I'm going to do a need assessment. I'm going to look at the Oba or the Yaloja or something. Because a town hall meeting, let me even know what they want. So cultural and religious beliefs are good. Tradomedicals are still there. So the thing is that
so anyone you are doing go for
it, and then let it be that it's something that is working. It's not causing more harm. It's not killing people. It's not bringing a lot of complications. So these are some of the things that we should look into as parents, especially mothers. You know, mothers are the natural nurturers. So they're the ones that most times gives the medication. Even if you find a home, I'm the doctor in my house. My husband is not the doctor. But when our kids are not feeling fine, he's the one saying, are you giving paracetamol? I say, oh, why do you become a doctor? Like,
let me do this.
Let me do it, you know? And no, we need to even go to the doctors. You know, I'm not a specialist in that area. So parents, when it comes to set medication, they should take a back seat. It's not one size fits all. And it's not what has happened to my child A that will happen to my child B, because we now have antimicrobial, antibiotic resistance, and it became worse during COVID. With all the mixture, and then let me take this, the virus will not. So that antibiotic resistance is so high now that when you eventually need a particular antibiotic, it doesn't work. And that doesn't, because you hear some people telling you, because we are going to be on a journey from Lagos to Benin tomorrow, let's start taking flagyl. You don't have a running stomach. Nothing is wrong with you. What are you preventing?
True. Thank you so much. I mean, I have so much to ask you on this, but then again, we're short on time, so we have to go. Thank you. Thank you again.